Because in India, the breast cancer is not only a medical challenge, it's also social silence. According to the Indian Council of Medical Research, breast cancer accounts for nearly 28% of all cancers in women in India today. And the Globocan estimates more than 2.3 lakh new cases annually, which also results into about 90,000 deaths every year. Every 6 minutes a woman is diagnosed, every 10 minutes a life is lost. Most cases are detected late, in advanced stages. Survival rates decline not because science is weak, but because access is delayed. At NXT, we did not want innovation to end with applause. We wanted to travel. That is how Namo Shakti Rath was born. The name Shakti is deeply personal to me because this is something which I have taken as an inspiration from my mother and all the motherhood that comes with it and the power of women. And the larger vision draws inspiration from our Honorable Prime Minister, who emphasized about preventive healthcare, digital transformation, and last mile delivery that has shaped India so far and will become the bedrock of a foundation of a developed India by 2047. So if we want to be a developed country, we have to have an ecosystem which is conducive for healthcare sector and especially for the people who need it the most. And that's exactly what the Namo Shakti Rath represents, a confluence of personal conviction and national vision. We chose an AI-enabled, non-invasive, radiation-free screening technology, which is no touch, no exposure, no radiation. It uses thermal imaging integrated with AI-based pattern recognition and automated cloud analysis to generate instant digital reports. It preserves the dignity of women, it respects privacy, but the real innovation is not the device, it is the delivery model. On 17th September, this initiative and the Rath was flagged off in Haryana. On 14th January, it was launched in Varanasi. Today, more than 30,000 screenings have been conducted in Varanasi and Ambala alone. Multiple vans, we have about more than 42 of these mobile vans which are operating on a daily basis with a dedicated team, with digital dashboards which track the progress in real time on case-to-case basis. Every participant is registered through secure digital systems. Each screening generates a unique ID, geotagging locations, technician authentication, and encrypted AI reports. This is structured, this is accountable, and it is scalable. This is the AI translated into public health architecture. When a mobile van enters neighborhood, it does more than conduct screening. It breaks stigma, it normalizes conversation, it tells women that early detection is strength and not fear. Earlier, healthcare waited in buildings. Today, healthcare moves on wheels. That is what driving AI impact through real-world action truly means. NXT proved that a conclave can be more than a discussion. It can be a catalyst. It can track ideas beyond the stage. It can convert dialogue into deployment. Artificial intelligence must not remain a lab achievement. It must become a humanitarian instrument. A developed nation is not defined only by GDP growth or digital exports. It is defined by whether its mothers and daughters survive preventable diseases. For me, Shakti is not just a word. It's my mother's blessings. It is every woman's strength. It is the moral force behind this mission. When history looks back at this era, it will not remember how advanced our algorithms were. It will remember whether technology stood with humanity. Namo Shakti Rath is not just a vehicle, it's a moving light, and that light carries dignity, assurance, and hope. I just want to share a few personal instances with you before we start the panel. You know, it was a really heartwarming and a satisfying feeling when you attend these camps, because when people from all walks of life come, I don't think the people working on the project, on the technology, on the quantum aspect or the AI aspect of it would have ever thought that what they are working on will have such a great social impact on Asha Rani in Ambala or Fulo Devi in Varanasi, in terms of what difference it can make. The problem is of awareness as well as the social stigma that remains. While we were curating the technologies, we looked at the Indian problems, the problems that we face in the Indian mindset, which was definitely a big advantage that there was no radiation in this technology, but also the social stigma that came in some parts of rural India was also to be addressed because it was non-touch, non-invasive, and no pain. These are parameters which have helped us expand the campaign and take it to the furthest parts of the country, and which we are expanding on now and taking it to the next level where we are doubling the number of centers. Not only does it provide an alternative to this first step of screening, which is the first point of contact, but also reduces the load on the entire healthcare system to be able to filter in and funnel those cases which have been defined because of the rates of efficacy and specificity, which is about 95% through this technology. So I will not take more time. I will just ask the panel to start the conversation so we can have a dialogue which is more relevant and related to the issue at hand. Thank you very much.
Expo,
so I'm going to start off with from Nirmay. I think he will set the ball rolling. If you can put the context as the technology and the thought process behind it, and then we can take it one by one to all our esteemed panelists on the...
Sure. Thank you so much, Sri Kartikeya sir. I will be quickly talking about Niramai and our technology. Just to give a full background, Niramai is the startup based out of Bangalore. It's an AI medical device company. We have built a device called Thermalytics. Niramai is an ISO certified company, ISO 13485, ISO 27001. Thermalytics, which is the main product, is actually being built for breast cancer detection. Thermalytics is registered with CDSCO. This is completely Make in India product, which is very important to talk about it. It's obviously an AI product. And then Thermalytics is also, CE mark approved. The other product which we have for breast cancer is Smile 100, and Smile 100 is US FDA cleared. So we are among one of the pioneers when it comes to AI, having built a device, getting both CE as well as US FDA clearance apart from CDSCO clearance in India. So sir was talking about, Sri Kartikeya sir was talking about, some of the macro, and we were also looking at this, late detection. One of the primary factors is access to screening, as he said, rightly said. Just to give some more numbers to it, while 28% is the incidence rate, which he highlighted, but the screening rates in India is less than 1%. So you look at women population and you look at, the screening numbers in India. So what it means is definitely India needs more innovative technologies to fill that gap. So the current existing technologies are able to reach only 1% of the population. Now, with this innovation, with this campaign, which sir explained, I think there is a huge potential to reach this to every woman, right? So that is where we are thinking from Thermalytics perspective. And just to little bit double click on the product. So the product is absolutely non-invasive. There is no touch involved to the woman. Just imagine a screening room area which is built privately for the woman. Woman enters into it and closes a room. And she is alone inside in front of the thermal imager. And she sits there for 2 minutes. A thermal image is taken which is below the neck and above the abdomen. And that's it. And she comes out, and then her job is over and the report is ready by the time she comes out. So it is as simple as that. Nobody has seen her, nobody has touched her, no radiations at all, and then the report is ready. It is that kind of process that we are talking about. So that's quickly, briefly about the product.
I wanted to ask you, how is it that the Indian, being an Indian company, which is part of Make in India, and how have you taken the sensibility of the Indian context into account, which has been helpful in this campaign? I want your perspective.
Definitely, the perspective is that this no touch is definitely one of the important, aspect. Even if we look at existing methods, which is clinical breast examination, which is a hand-based examination, which involves touch, and maybe some of the other technologies, which are mammograms, which requires compression, and it is also restricted to few hospitals or large hospitals. So access becomes an issue. So in the Indian context, this portable device can be taken to gullies and mohallas and really deep into the communities. And women are, educated through the programs like this, like you spoke about, Namo Shakti, Rad, where the education is provided that there is a non-touch, non-invasive, radiation-free drive is going on. So a lot of advocacy happens through, through this program. And then once women are convinced, they come forward automatically. And we have been seeing, crowds every day in this program because they themselves experience it. Because we believe ASHA workers are the real threats to the to the communities. They can really go deep into the communities.
Anganwadi workers, the ASHA workers.
Anganwadi workers, ANMs, they can connect with communities faster. And once they are educated about this device, it is that simple, non-invasive. They quickly talk more in the community to bring them people.
Yeah. Can I just butt in here a little and to tell you about us at the Indian Cancer Society, where generally it is comprised of volunteers. It's the largest volunteer-based organization. And most of the people who are there working as volunteers have they themselves been through the process of going through breast cancer or any one of the other cancers. And if they haven't gone through it, well, they have nurtured someone and cared as a caregiver for that individual. So they are very familiar with it. And since the force is comprising of such people who have experienced it and gone through it all, they are made aware of the things by a personal experience right there itself. For example, there's me myself here. I was able to detect my own cancer through a breast self-examination, which I had been hearing people talk about a breast examination. And it was not taught to me by anyone, but I had just read it and heard about it. And lo and behold, I found my own cancer, and it was in the first stage. Now, with this particular device, it is very difficult to check it out in the first stage itself, because a mammogram at least gives you that, that precise thing that, yes, in a way precise, at least 90% precise, that, yes, there is a probability of a nodule having developed there, which can be further investigated. But this, so you're groping in the dark for quite a fair time before the lady is actually diagnosed. But yes, what is a good point of this is that it can be done in masses, unlike mammograms, which cannot be done. It's a limited number that can be done. So when you're doing screening on a mass scale, I suppose this is the best way to do it.
Dr. Mandeep, would you like to come in?
First of all, I want to congratulate you. I want to congratulate my Prime Minister. इंडिया का प्रॉब्लम है, इंडिया का सॉल्यूशन है. सबसे बड़ी बात ये है. देखिए, सबसे बड़ी बात ये होती है कि हम ब्रेस्ट कैंसर हमारा सबसे बड़ा कैंसर है. मुझे अर्ली डिटेक्ट क्यों करना है? मुझे अर्ली डिटेक्ट करना है क्योंकि मेरी लाइफ बचानी है. If I have a stage 1, stage 0, my survival is 80 to 90%. If I have a stage 3, stage 4, my survival goes down. Stage 3, 50%, stage 4, we all know that. Secondly, if I have a stage 0, stage